You're 3 months out from bariatric surgery, you're losing weight, you're feeling better than you have in years, and then you step into the shower and there's a clump of hair in the drain. Then another one, and on your pillow, and on your brush, and in your clothes, and suddenly your thinking isn't about how much weight you've lost, it's whether you're gonna lose your hair. I'm a bariatric surgeon, and I have this conversation constantly with my patients. Hair loss after bariatric surgery is one of the most common, emotionally distressing side effects. But here's what I want you to know right now. It's almost always temporary, and it's not a sign that something went wrong, and there are specific things that you can do about it. How common is it? Let's start with the numbers, because it helps you to know that you are not alone. In the largest meta-analysis on this topic, published in 2025, they analyzed 41 studies over 7,000 patients and found that approximately 47% of patients experience hair loss after bariatric surgery. An earlier meta-analysis put the number at 57%. So roughly half of all patients will notice increased shedding. This is not rare. The rate varies by procedure. Gastric bypass has about twice the odds of hair loss compared to the sleeve. The duodenal switch has the highest rate of all, because the more your surgery changes nutrient absorption, the more likely hair loss becomes. Here's the reassuring number. In a study of 156 women after sleeve gastrectomy, permanent hair loss was observed in 0 patients. Not 1, 0. So why does it happen? Your hair doesn't grow continuously. Each follicle cycles through 3 phases: a growth phase called anagen, which lasts 2 to 6 years and includes about 85 to 95% of your hair at any one time; a short transition phase called catagen; and a resting phase called telogen, which lasts 3 to 5 months before the hair falls out and a new one starts growing. After bariatric surgery, the stress of rapid weight loss, dramatic caloric restriction, and hormonal shifts pushes a large number of the follicles out of the growth phase and into a resting phase all at once, up to 70% of them. This is called telogen effluvium. It's the same type of hair loss that happens after childbirth, major illness, or any physical stress. The key point, the hair isn't being destroyed. The follicle isn't damaged, the hair is just entering its resting phase early and then shedding on schedule 3 to 5 months later. And that's why hair loss shows up around 3 to 4, not right after surgery. The typical pattern is the shedding occurs around month 3, peaks around month 4 to 5, and gradually resolves by months 9 to 12. In that study of 156 women, 79% reported hair loss beginning between months 3 and 4 and lasting of an average about 5.5 months. Telogen effluvium from rapid weight loss is the primary driver, but nutritional deficiencies can make it worse, last longer, and harder to recover from. This is the part you can actually do something about. Protein is number 1. Hair is made of keratin, a protein. When your body doesn't get enough, it prioritizes vital organs and deprioritizes hair. After surgery, your food intake drops dramatically, and protein is the hardest macronutrient to get in small volumes. The AACE and the ASMBS guidelines recommend a minimum of 60 grams of protein a day, with a target of 1.5 grams per kilogram of ideal body weight. Studies suggest 80 to 90 grams a day is even better, and many patients can't hit these targets without supplementation. Iron and ferritin are next. A meta-analysis found that ferritin levels were significantly lower in patients with hair loss. An important detail, your iron can look normal on a standard lab test and still be too low for hair growth. Ferritin is a more sensitive marker. Zinc is also critical. Patients with low zinc and iron levels were 4 times more likely to experience hair loss. But if you supplement zinc, you must also supplement copper, 1 milligram of copper for every 8 to 15 milligrams of zinc, because zinc can cause copper deficiency. Folic acids were also significantly lower in patients with hair loss. It's essential for the rapidly dividing hair follicles. What about biotin? Despite the marketing, the evidence is disappointing. In a study of 156 women, only 23% with confirmed biotin deficiency who took supplements reported meaningful improvement. It won't hurt, but don't expect a magic bullet. One more thing, a 2025 study found that drops in serum albumin and calcium at 1 month after surgery were independent risk factors for hair loss. Overall nutritional status matters, not just one vitamin. So what can you do? Here's an action plan. Step 1, hit your protein targets every day. 60 grams minimum, 80 to 90 is better. Use a protein supplement if needed, especially the first 3 to 6 months. This is your number one tool. Step number 2, take your bariatric multivitamin every day without exception. Not a regular multivitamin, but a bariatric specific formulation with higher doses of iron, zinc, folic acid, B12, and vitamin D. After bypass or duodenal switch, you need 200% of the daily value. One study found compliance drop from 97% in year 1 to just 78% by year 3. Don't let that be you. Step 3, get your labs checked on schedule, quarterly for the first year and then annually. If anything's too low, your doctor can prescribe targeted supplementation at the therapeutic doses. Step 4, if you have confirmed zinc deficiency, treat it. Studies show zinc supplementation achieves cessation of hair loss in most cases. Remember the copper rule. Step number 5, be gentle with your hair during the shedding phase. Avoid tight hairstyles, excessive heat, harsh chemicals, and aggressive brushing. These won't cause the telogen effluvium, but they worsen breakage. Step number 6, manage your expectations. The shedding peaks around months 4 to 5. For most patients, the worst is over by month 6, and significant regrowth is visible by months 9 to 12. Your hair will come back. So when should you be concerned? Most of the time this is temporary and self-limited, but talk to your doctor if your hair loss continues beyond month 12 with no improvement. That may indicate an uncorrected deficiency. Or if you notice patchy bald spots rather than diffuse thinning, that's a different condition and needs evaluation. If you're experiencing extreme fatigue, brittle nails, numbness or tingling, or unusual bruising, these could signal more significant deficiencies like iron deficiency, anemia, B12 deficiency, or copper deficiency. And if you're a man with a receding hairline or crown thinning pattern, this may be an androgenetic alopecia, a separate condition with different treatments. The bottom line, hair loss after bariatric surgery affects roughly half of all patients. It's caused by telogen effluvium, temporary, triggered by rapid weight loss. It starts around month 3, peaks around months 4 and 5, and resolves by 9 to 12 months. Permanent hair loss is extremely rare. The things you can control: hit your protein targets, take your bariatric multivitamin, get your labs checked, and treat deficiencies aggressively. Your hair is going to come back. This is a temporary phase of progress that's adding years to your life and life to your years. Don't let a few months of shedding overshadow the incredible transformation your body is going through. I hope this video helped you. Save it and share it with someone who's going through the same thing. And subscribe so you don't miss the rest of this series. I'll see you in the next one where I discuss loose skin after surgery. Real science, real surgery, real results.